Ladies and gentlemen, this is the Dental Up Podcast, brought to you by Keating Dental Arts, a full-service, award-winning dental laboratory. Each week, you'll learn tips and techniques from real-world dentists, bringing you in-depth interviews, motivating stories, current events, and sports. Here's your host, Sean Keating.
Hey everyone, Sean here. Welcome to another episode of the Dental Up Podcast. Our guest this week is a graduate from the University of Pennsylvania School of Dental Medicine. He completed a general practice residency at the Albert Einstein College of Medicine and HHC in the Bronx. Following 9/11, he joined the Tower Ladder Company as a volunteer firefighter in the Briarcliff Manor Volunteer Fire Department, where he currently remains active. Practicing from the Bronx, New York, please welcome Dr. Paul Hertz, DMD. How's it going, Dr. Hertz?
Very good. Thank you, Sean. Thank you for having me on.
Oh, dude, thank you so much. We've been together so many years. When I hear Paul Hertz, I'm like, God, what's it been, 30 years probably? It's been a while.
Yeah, I was one of the guys who came with you when you started.
Oh, I know. And I worked with you before, and I even started my own lab, and it's just a great thing, man. I mean, I remember, too, you had a partner back in the day, Dr. Wasserman. Was it Hertz and Wasserman in your practice? And I think did he retire, I think?
Nope.
He's still going.
They're still there.
Yeah. I think he has a son, too, that's practicing now, huh?
Right.
Yeah,
yep.
That's amazing. Well, that's so cool, dude. I thank you so much. I know you're my big New York doctor, man, the Bronx, dude, and I'm a big sports guy. I always like to start off talking about sports, and I know you're a big Yankees guy, but what about with?
Oh, you bet.
You
bet. We can see the Yankees outside my window.
Oh, that is so amazing, dude. That. I remember back in the day, the Bronx wasn't the nicest place in the world. Now it's like the hottest. It's like Soho or whatever. I mean, it's like all the people are buying all the properties. And
yeah, the Yankees are my team, and it's too bad those damn Red Sox got in the way.
Can you believe that? I mean, with those two hitters you got those two like lumberjack dudes. I don't even know their names, but they're just monster home run hitters, and they didn't really come to that series, man. It's like, what the heck? But it's good to see him back in the, it's been a few years since they were up, and from the old Jeter and A-Rod and times, but even before that with Reggie Jackson. I mean, it's kind of like Dallas Cowboys, America's team. The Yankees, you either love them or hate them, and they've just got such a dynasty there, and through the years. But it's good.
Coming back.
Yeah, it definitely is.
Watch it next year.
Yep, I think
Aaron. We got the team, and it just was Boston's year, and I'm having battles with my buddies here all the time about that. Although Mookie Betts, he's got to be the MVP this year.
Oh yeah, that guy.
Even better than Trout. Trout may be the best player in baseball, but Mookie won this year.
Yeah, he's an amazing player, man. I remember there's another Mookie guy. I don't know if it was in baseball or football, but I remember that name. But there's a
Yankee named. Wait a minute, Mets. He's the one who Mookie Wilson.
Yeah, maybe that
who hit the ball through. The first baseman's legs in when the Mets won back in
the World Series. That guy. Yeah.
Oh gosh, that's bringing back memories.
I remember that like it was yesterday. That's so cool. Yeah. What about with?
Too bad we can't put a football team together.
Yeah, what's up, man? Hey, the Giants just got to win. I mean, Eli Manning, man. I mean, when they're going to put that guy out to pasture, it's just.
I think actually they would have even last night if the backup didn't get arrested for some driving incident during the week.
Oh, you're kidding. Well,
I actually think that his days are numbered. If he's going to be starting, it's one or two more games.
Yeah, and you just look that. I mean, they won the game. I think last 50 seconds of the game, he threw a touchdown. I think it might have been to Odell, man, and that guy's such a stud, and that guy should be getting 3-4 touchdowns a game. I mean, he's just so amazing. But I think your O-line's having the O-line there on the Giants. It's nothing to.
They've got some talent on offense, and not much on defense.
Yeah,
this guy Barkley he's the real deal.
Yeah, that's amazing though. Well, dude, that's so cool, man. Well, thank you so much again for coming on. But hey, let's dental up now. So tell me, Dr. Hertz, why did you get into dentistry, and at what point did you think I want to be a dentist?
My father was a dentist.
Oh, okay.
Real good dentist. I actually didn't know until I was in school, and I actually took medical boards and actually did better on them.
No kidding.
And my father said, "So what do you think? Why would you, choose medicine over dentistry?" I said, "I really don't know." And he said, "Well, I'll tell you what you do have is you have a business." I thought about it, and I realized I didn't know much of anything, but I'm sure glad I made the choice because it is the right choice for me.
Yeah, that's so awesome. You're a great dentist, man. You really are. And you've got some real talent, and also you're a little entrepreneur when it comes to developing products and stuff like that. I know we worked way back in the day on a product that we sell quite a bit of. It's called the Delineator, and it's something that it's a. Once you
I got to thank you guys for that for sure, because it was my idea and I got the patent, but it could never have been developed without you. You guys were wonderful with that. and it's really, I think the concept still has room to grow. I mean, this is originally the thought was, and we just never seemed to get around to hook it up with the CT scans and, make it
radiographic
useful. Well, make for planning, for implant placement planning. It's a nice little product that has a lot of good uses.
Yeah. So what it is it 3-in-1 or 4-in-1? We got a temporary. We got an implant placement sleeve. What else do we have on them? Tell me a little bit about the Delineator, what it does, and a little bit about.
Well, one of the things that I find is that if you're using it as a sleeve to place the implant, you also know where it is later when you try to uncover it. There's no surgery to expose it. You just kind of go right through that hole and you find it there. And you can also, under certain circumstances, use it to, screw it down and keep that implant stable. But most of the time what we do is, not the implant stable, the temporary stable.
Yes.
Most of the time what we do is we, just take it out, make sure it's well cleaned. It gives you access to the area, and certainly looks good.
It's amazing. We do quite a few of them, and the doctors love it. Just even for the temporary, while it's waiting for the the implant to osseointegrate. But it's a neat thing, and we do quite a bit of them. And the Delineator, that's a Latin word for the word map. So it kind of a neat thing. How'd you come up with that Delineator name? Just kind of. You remember the old Latin in high school, or tell me a little bit about how you come up with that name?
All of these things go through, notebooks and lists. And one of my patents is the Savior implant, and that was to place it actually at one point into maxillary sinus, where there's a part that actually moves and lifts the Schneiderian membrane with kind of like an umbrella. You going through.
Yep.
So you place the implant where you want it. You push up the umbrella, expand it, and place the bone around the implant as opposed to doing it the other way.
Yeah.
Same time. I mean, that's the idea of all these things. It was trying to solve problems that I come across on a day-to-day basis as wet finger dentist.
It's been a great thing for us, and I think we're going to have more things in the future working together. You're a real smart guy when it comes to, and heck, I think you even developed, you have a whole bleaching system now. Tell me a little bit about that. Now, there's so many bleaching systems out there. What is yours like? Why is it different? Is it better with sensitivity? Tell me a little bit about your bleaching system that you got working for.
Started back when I did, left my partners and started on my own. And at that point, we had been a Zoom office and did a lot of that kind of bleaching.
Okay.
And I found that it took a lot more time and effort than was supposed to. It cost a lot for the patient. It took 2 hours of chair time because it's 3 20-minute sessions, but it was between the setup and the breakdown. There was always sensitivity. There was always chemical burns on occasion. Yep. When isolation wasn't adequate. There were a lot of problems. And I said, you know what? As a cosmetic guy, I've got to find another bleaching system. I got to do better. And I went out and I started researching and talking to everybody. And finally, actually, a chemist came to me through word of mouth. And he says, I've got a product, and it's different. It's neat. And this product, and and I call it dental detailing, is it's neither hydrogen or carbamide peroxide. There's no peroxides in there. It is a totally different chemistry. I'm not quite talking about the chemistry yet because it's still something that we're working with, but we are ready to start rolling it out a little bit. It actually is a desensitizer. It actually, in 15 minutes of chair time, 15 to 20 minutes, and I do it immediately after the cleaning at the same visit, so that it becomes, where the cleaning is often a loss lead, you can, bring it back to being a profitable situation where you place the product on the teeth immediately after polishing, and it will not necessarily whiten the teeth, and that's why we call it a brightener. It brings the teeth back to their more original color. It is not changing the organic matrix. It is just cleaning out the porosities of the teeth. It is a nice little adjunct because it's fast, it's easy, it doesn't burn the gums. You can have your hygienist easily do it at the end of cleaning.
What about going to the teeth now? They don't have to rubber dam it or nothing. They can just go right to it.
No rubber dam, nothing. All I'm doing is a cheek retractor. Because I'm just trying to make sure that the teeth are exposed. Mm-hmm. And they do have a saliva ejector in, and it's a dual syringe, and we just spray it right on the teeth, move it around a little bit, and just leave them sit. And at 10 minutes, we'll, shake it up, do it again. And at the very end, what I've been doing is actually adding a fluoride, which actually goes into those open tubules, because when you're cleaning them out, you are opening. And, to tell people, now you can't drink coffee or drink red wine, that's never going to happen. Exactly. So the fluoride itself actually protects keeps the tooth whiter for a longer period of time just by closing up the tubules and being in there for as long as it is. Obviously, it's good for the teeth. Sean, I'm glad you asked, because I am very happy I am trying to get this out. Maybe if with your help, we can pass it on to some of your podcast listeners. I'm willing to give free tubes to anybody who wants to give it a try, maybe with their next Keating case that they send into you.
Yeah, we'll do that. I mean, I would love to do that. So if anyone out wants to ask for it, if you're sending a case, we can send some tubes out to you to try it. I want to try some myself, because I'm looking at the stuff I use. It's called Opalescence Quick PF, whatever. 45%, and this stuff kicks the crap out of my tissue, man. I'm like, well, 45%, that's a little bit much, but with yours, a whole different beast, man. Let's check this out for sure. So we'll put something on there, guys, on maybe if you click on or something, there's a thing on our website, Keating promo or something. If you guys want to go in there, we'll give you some of these.
We're calling it dental detailing, because we do it at the end of the cleaning. We get your teeth, we give you regular prophy, and then if you want a little extra, you get that dental detailing. Got lots and lots of return customers. I've done, I got to say, thousands of these already.
No kidding. No, that's dental detailing. So just ask for it, kind of like a gift, So if you guys hear it, go ahead and call it in. You can ask any of the customer service. If you're working with us, even if you're not working with us, that's fine. Just get us your info. We'll get you some of this out for you. I mean, for Hertz, you've done so much with us, and you've given me so much money on all the teeth. We've done thousands of teeth through the years, and I can't thank you enough for that. But it's probably close to 30 years is right. Yeah.
And I appreciate your work. You've got some really key, very good staff with you guys, and I appreciate it all the time. And the more I have off and on largely because of the research in some of the projects, I've used other labs along the way that might specialize in certain things that might, I thought help with me. But I tell you, I keep coming back, and because the personnel that you have there, your managers, Alex and Steve, and of course Bob and Jim. Those guys are just the best.
So cool.
No problems, because anything goes wrong, and obviously it's dentistry, so things are always going wrong. It's good to have somebody on your team.
Well, okay. Hey, tell me a little bit about your practice now. What kind of how many ops you got, and what kind of people you got working for you? Tell me a little bit about your staff and your practice, if you could.
Well, I'm absolutely on my own now, and I find I appreciate that, and I'm actually much happier doing that. I've gone from having multiple partners and hygienists, and no, I don't even have a hygienist. I'm very happy not.
No kidding. You're just rock and rolling it yourself, huh?
I have absolutely stayed away from insurance. I don't take any insurances. We'll submit if anybody has, and they can go out of network, and we do the legwork. But at the moment, I think that's the best thing. I have more control over my time. I know what I can squeeze in where. I'm not chasing anybody or anything. And
I got a lot of guys that do the same thing, man. They practice on their own, and it works. And a lot of them are all fee for service, and it's just no. If it works, baby, and you've been with the, you've had big practices and work with other guys, and it's always been a big ordeal. And for you now to be on your own doing that, it's been a while now. And I just think, and you're.
Well, I'm 10 years now on my own.
Yeah, and your lab bill is as big as it's ever been, man. So things are going good. And how do you drive patients from, to bring them to your practice? What do you do? Are you doing any special marketing, or is it just through, referrals from patients? But the Bronx, are they coming just from the Bronx? Are they coming from all the 5 boroughs? Are they coming over from Jersey? Tell me a little bit about how you get patients.
Well, I'm in Riverdale. So Riverdale is, we say it's the Bronx. So most of the people in the Bronx don't think that Riverdale's the Bronx. Okay. This is a little enclave that's, it's a really nice area.
Yeah.
Most of my patients are local. Most of my new people do come in from word of mouth. It's kind of a transient community too, in that people come here when they're leaving Manhattan to go to the suburbs or vice versa. Okay. And they stay there's a lot of older people, but there's also a good percentage of people come for a couple of years and then they move on. So there's a lot of turnover. I send out regularly mailings now, and then just the bulletins into churches and temples around and things like that. That's really the extent of the advertising that I do.
That's so cool. It's so very little advertising, but you're still booming, man. And it just because you practice good dentistry.
I do little talks around. I'm going to start something that I think is a California phenomenon, and that's the dental in-office dental benefit dental clubs or whatever.
Okay.
Where I'm going to give that a try.
Yeah. For
the people who don't have insurance. I mean, dentistry is expensive. Sometimes when I look at some of the bills, I go, man, I can't afford that.
Oh, I know.
But today was one of those days. I just finished up where I was really happy that I was able to work the way I do. And this was one of those days where you really like dentistry. Patient came in yesterday. I've been with her 10 years more, okay, but she's never been a good patient. She comes in every 3 years, maybe 2.5 years, and only when there's a big problem. And I keep telling her, you're going to have more issues. You're not going to do well with this. And then, unfortunately, she came in this time after I hadn't seen her in about 1.5 years, and she'd been diagnosed with cancer. And she had been, going through all her tests, and she's finally starting her chemo tomorrow. Now, she showed up yesterday, and she had several, when I did my examination and I took a panoramic, areas at the apices of teeth. And so I rearranged my schedule the last 2 days so that I could do all of her root canals. And we did 3 root canals in 2 days now, and then I did Pose to support them because she's starting her chemo tomorrow. But I really was so happy that I was able to be there to help, and I was able to move my schedule around. And we called, we called the patients who were scheduled before and moved them around and told them that this was an emergency and it was very important, and that, they know that if they were in this situation, I would do the same for them. And I have patients that have been with me since I've started, a lot of them actually. And it's because of my ability to be part of their lives.
Yep.
And I do that because I'm not forcing, I'm doing the work that is necessary and only the work that is necessary. And unfortunately, I say that because I see that's not always the case out there these days.
Yeah.
And sometimes it's because insurance, if you do a fair job for a fair price, and very much like you guys, mm-hmm. I mean, with your lab, you're not the cheapest guy in the block, but you're given a great job for a fair price. And I don't care. I'm not looking to save money. I want a good job. I want the best for my patient. And this is what I'm looking for, and this is what I'm looking for with my life.
Yeah.
And I think that with that attitude, and that's what I appreciate most about Keating, because it's very similar to my attitude about how I practice. That's the formula for success.
No, it really is, and that's a great attitude, and it's rubbed off on us, both ways. I mean, we've got a bunch of doctors like you that kind of are trying to do the best job they can and are looking for something in a lab that is part of a relationship together. And there's some guys that are going to bounce around through their career, trying to find the right lab to help eliminate as many of the headaches as that a lab can give you a lot of headaches if they're not on the same page. But now it's totally true. You've always been that way, straight up, and always looking, for the patient, and always been fair with us, and and you're a smart guy for sure, and you're always pushing the envelope and kind of thinking of new things, and I love that. And heck, even too, how long you had it now? You got the 3 shape, man. You got the trios. Tell me a little bit about that. What do you think about it?
I finally, I've been looking at it for so many years.
Yeah.
Was way back. It was actually one of the things and reasons things didn't go right with my other relationship, is that they weren't interested in spending the money. It is expensive for an individual guy.
Yes.
For one person, it doesn't necessarily make sense, but I need it for some of the research that I'm doing too. I'm glad that I have it.
Yes.
It's there's a big wow factor. The patients are, they're blown away when they see the stuff, but it changes the way, it does change the way you practice. Is it necessary? That's an interesting question that I ask myself all the time. I'm not sure. I mean, I don't think I ever had I don't think I had problems with my impressions. I would get good work back. I didn't have that many remakes ever.
Yep.
You can use it for a lot of cases, and there's a lot of cases you can't. There's still a lot of places where you're going to be taking impressions.
Yep.
Bridges. Most of my crowns the teeth are beat to hell. Yeah. There's many people these days who would say that most of my crowns are heroic dentistry because they're ripping them out and putting in implants.
Yeah.
But implants aren't the answer for everything.
Exactly.
I'm interested in implants. I've got an entire implant system at the patent office for 3 years now, and it's been rejected 3 times already, and they're wrong, and it's going to be unbelievable. And I know that.
That's awesome, but it's tough.
But I'm working with it. I'm working with implants, but it's not the answer for everything. And too many people are just ripping out teeth. Too many people are not doing 3 surface fillings, and they're just going straight to the crown. And too many people, and that's short-sighted.
Yeah.
You make a couple of bucks, and it's short-sighted. Those patients are there for the long run.
And those implants, I got a few guys and try to get into that implant field, man. It takes a ton of money, and the whole FDA thing, compliance, and oh man, it's like even too with me. Milling my own, you guys were trying to get me, Sean, you can mill your own, you could do all this, and I just don't want the liability. I just don't. I make teeth, man. I don't make implants, and I just know what I do best. Before too, I was going to start selling scanners and all this Keating digital, had it all worked out, and at the end of the day, I want to sleep at night. I want to make teeth, especially now with PFMs. I mean, PFMs, there's some anxiety to PFMs. I still do thousands a week of PFMs, but yet, with the breakage back in the, you got to get the coefficient of thermal expansion has got to be exactly right, what you're matching to your porcelain. You got to have your opacers done exactly right, so you got the right oxide layer, so it's bonding. You got to have your metal 3/10 or in certain areas because it can't be bulky at the margins, and you do all those. There's so many moving parts to a PFM, and then you have a little bit of breakage, a little bit of crackage, man, and it'll wear on you. But now with this new monolithics that the aesthetics are rivaling, EMAX, but the strength's there. So, I mean, it's just taken so much off our stress level, and it's just, it's such a neat thing with dentistry being so much more predictable and, just so much more longevity to it. And I don't want to make crowns.
Go ahead. I am not a zirconium fan.
I know you're not. That's why I said that.
I absolutely do not like that. I mean, I like the Emax. I do not like the zirconia. And
tell me the reason why.
There are a couple of very quick reasons. One is if you are, most teeth opposing a zirconium crown are going to break eventually. It's just too hard. If you ever tried to cut one off, if you ever tried to do a root canal, if you ever tried to, it's just not worth the effort. Yeah. If you haven't fried that tooth when you're trying to, cut it off, you've fried it then. Yeah. They break everything they touch because they're so hard, and they come loose. The only crowns in the last 20 years that I've placed that have come loose have been zirconium crowns.
Well, maybe you're not properly preparing them for cementation.
Could be. Could be. I mean, and right? Absolutely. I'll accept that. And the time will come too when a new thing comes across your desk that you're going to see it's worth doing. Yeah. I mean, I remember the story because you had a chance to do those, which I think are a joke, and I'm glad you didn't do it. The
art glass,
the smile. The snap-on smile.
Oh, yeah. I still do a ton of those. We call them strap-on. We don't want to get sued, but it's called the strap-on smile, and I do them I do them on my temps, baby, and you can have crooked teeth or whatever, and you just click these little things on, and I see some guys on the interweb now, like on Facebook, and they got a different name for it, but it shows all these different ladies and men that they're showing their teeth, and then all of a sudden they click on this little appliance, and what a major thing. I mean, especially if you're going to a wedding or you're seeing the in-laws or relatives you haven't seen, and all of a sudden you got a beautiful grill, and just pull that lip back. You don't want to pull it out too much and hold it open too much because I don't know. To a guy with a trained eye for teeth, you could probably pick them apart a little bit quicker than most people. But it's a great thing to give to certain patients. So I'm surprised Denmat maybe it's a Denmat company that's doing it, because Denmat's a pretty big company. They don't let you mess around with their snap-on smile. But so yeah, and you can go with the whole thing. And now you got zirconias now that are going, from 500, 600, 650 megapascals of flexural strength. A lot of the older stuff is like 1,1300 is real strong. But same thing can be said with PFMs, your feldspathics with a lot of these labs. I mean, the grain structure of that ceramic on those PFMs, they can grind away and break on opposing teeth, but they can also grind that opposing teeth down like sandpaper. And so, I mean, right. It is something that I think with a lab that is bringing things up to a natural shine by polishing the material and then glazing and making sure the glaze is nice and clean and all that. It's just, there's techniques to it for sure, but there's just some old school dudes and, that are just against the zirconium. I'm just saying, me as a lab guy, I love it because it's not breaking, and I don't think I've ever heard of it breaking anything opposing it. But, and I see a lot of dentistry each week and monthly, and, so it's just something, teach your own on it. But, baby, it's not going away, and I'll still keep doing your PFMs and your EMACs. So, yeah, we'll agree on that. How's that?
All right.
So tell me, what about what's the dental conventions you go to, or for CE? Where are you getting some of that implant CE, or what are you doing? Just a local New York show? What are you doing for that?
I do the Greater New York show. I'm there the whole time because then I have access to some of the best people anywhere continuously. I talk to all the top guys. I make appointments to see them before or after their lectures, whatever. I also go. We have the Bronx Big Apple, which is a very nice small meeting. And most of the rest, I just pick here and there things that are interesting. We go around them. We're close to the Nobel plant here in Mahwah, New Jersey.
Oh, okay.
So I go there.
Yeah, we got Nobel right here, man. Their headquarters. That's a great company for sure. Noble Biocare, you're saying, right?
Yes.
Yeah. That's awesome, dude. You got to get out here and come see this one, man. It's like state of the art. It's big time. Probably the same there. But so tell me, I know you're at lunch here. We got to get back, but what are some of the do's and don'ts in your profession that you would like to share with some up and coming practitioners, some of the newer people starting out? What are some of the do's and don'ts that you could tell us about?
Well, I think we went through some of this, but don't cut corners. Do the right thing. Make sure your patient's best interest is first. It'll all come back to you. That's about the size of it.
Words of wisdom. Hey, Dr. Hertz, I know you're a busy man and I got to get back to work. Can't thank you enough, dude. Love you, man. When are you going to come out here and see me after all these years? Man, we've been together since 88 or whatever. I'm looking at my notes here. It's just
right.
long
Probably
time.
close to that. That's right.
88, 98, 2088. That's 30 years, baby.
30 years.
I'm done with this stuff, man. What do I got now? What about get on out here, man, and come see us. We'd love to have you out here, and maybe some of the seminars we got coming up, we'll get you out here for sure. But love to see you, and thanks for the delineator, and thanks for this new bleaching system you got working, and we'll definitely get out to the masses and let them know about it. But can't thank you enough for all that you do for us here at Keating Dental Arts.
Well, thank you, and I appreciate you guys.
All right.
Have a great day.
You too, man. God bless you, and we'll talk to you real soon.
Bye.
Bye-bye.
Thanks for joining us on the Dental Up Podcast Show this week. Make sure to follow us on Facebook, Instagram, and Twitter, or search the Dental Up Podcast on iTunes for our weekly feed. Don't forget to visit KeatingDentalArts.com/promo for exclusive offers. Keating Dental Arts is a full-service dental laboratory, and we're nationwide. We'd love for you to send us a case so we can show you the Keating difference. If you dig what you heard, please leave a review on iTunes, and we'll be back next week.